Hello and welcome. You're watching NDTV. I'm Sarah Jacob. India has reported 38,079 new coronavirus cases in the last 24 hours. The good news is that this is marginally lower than yesterday, and the deaths reported in the last 24 hours stands at 560. And India is all set to cross the 40 crore mark when it comes to vaccinations, says our government. But there are 6 states that are throwing up the largest number of coronavirus cases in this country. Tamil Nadu, Andhra Pradesh, Karnataka, Odisha, Kerala and Maharashtra are 6 states which have contributed 80% of the new COVID cases in India and 84% of the deaths in the last week. On Friday, Prime Minister Modi chaired a virtual meeting with the chief ministers of these 6 states, where he stressed the test, track, treat and tika or vaccinations to stop a third wave. But with the R factor at 0.95 and it was 0.75 just 4 weeks ago, and with vaccinations way below target, we are vaccinating an average of 34 lakh a day. We need to be doing way over 80 lakh a day if we are to meet the deadline set by the government by the end of this year. So, 80% of new COVID cases, like I said, are from 6 states. Now, there's Kerala that's leading the pack with 13,750 cases. They lead the states in the most number of COVID cases in a day. That is then followed by Maharashtra at 7,761. Tamil Nadu and Karnataka way below. Tamil Nadu in the 2,000 range, Karnataka in the 1,080 range. And now, today on the show, we are joined by a panel of expert doctors from these very states to get a sense on what is being done or what needs to be done to stop the spike and prevent a third wave of infections in India. We'll have Dr. Zulfi Nuhu, the state president-elect of the IMA in Kerala, Dr. Shashank Joshi, member of the COVID-19 Task Force Maharashtra, Dr. Vikas Bhatia, director of the All India Institute of Medical Sciences in Hyderabad, and Dr. Vishal Rao, the dean of the Center of Academic Research at HCG Cancer Center, member of the expert committee for COVID of the COVID Task Force for Karnataka. Do we have Dr. Suf? Okay, so we'll let me just go across first to Dr. Shashank, since you are of course from Maharashtra, in the hot seat and have been in the hot seat for a while, Dr. Joshi. Maharashtra leading the states with the largest number of cases, adding about 167 deaths over the last 24 hours. Now, the Prime Minister in his meeting with the chief ministers of these 6 states said that the states where the cases are rising the most or rising the fastest need to take proactive measures. Have these states, has Maharashtra been told what these proactive measures are? What are these proactive measures and are they being taken on the ground?
Sarah, thank you so much. I think we have always been very proactive. We need to test more, we need to trace more, we need to treat more. That has always been the case. Maharashtra, actually, the big metros are still very much down, whether if you take the metros of Mumbai or Nagpur. But if you take those 8 districts of concern, they are really worrying us. Leading the pack is Kolhapur, Sangli, Satara, rural Pune, Raigad, Ratnagiri, Sindhudurg and Palghar. And particularly there is a Kolhapur paradox, where there is almost above 45-70% of the population vaccinated. Our challenge, which is coming from Maharashtra predominantly, the 6,000-7,000 cases, which are down from 10,000. Mind you, Sarah, our TPR was almost more than 10% just 2 weeks back, is now coming down to below 5% in most of the districts of concern, and many other districts are between 5 to 7 or 8%. Is a little tighter contact tracing is required, and beyond that, we need to ensure that the less exposed or unvaccinated population is more vulnerable. So I think we need to have a zero tolerance for COVID appropriate behavior, which we keep on saying again and again. And we need to saturate these districts of concern with a larger, proactively give them more vaccines. So we have asked the center to give us more vaccinations. And of course, we need to ensure that there is no vaccine wastage. We definitely need to be very, very stringent, at least in the districts of concern, for a very tight micro containment and intensive containment strategy, so that there is no spread and there is no spreader or a super spreader event which occurs. Absolutely. So zero congregation, zero crowding, that is the order of the day, because now festive season will start. Just on Tuesday in Maharashtra, there is Ashadi Ekadashi coming up. and so many other religious and political gatherings are likely to come up in the next couple of weeks. See, these 8 to 10 weeks are very crucial for India in general, and these couple of states, but in particular. So we need to be vigilant, we need to be proactive, we need to be aggressive, because we are very worried that that R factor, which is gradually moving up, should not cross unity. Otherwise, the third wave will enter within a month's time.
Ironically, a few weeks ago, we were saying the R factor shouldn't cross 1. Now we're saying it shouldn't be crossing 2. But Dr. Joshi, what you're saying is absolutely right. The next 100 to 125 days are critical in the fight against COVID-19. That's what the government said on Friday. Yet, you know, we're seeing Sabrimala is going to be allowing visitors to the temple, 5,000 a day. They're opening up for 5 days. In UP, you're seeing a tussle. The Supreme Court has to tell the government of UP that you cannot let the Kuvar Yatra go ahead. Let's bring in Dr. Vishal Rao and Dr. Vikas Bhatia. Dr. Rao, this fall in COVID cases after the peak of the second deadly wave 2 months ago has slowed down, and this should be taken as a warning sign, has said the Niti Aayog member on health, Dr. V.K. Paul, to reporters. He said this on Friday. What is the government of your state doing? As Dr. Joshi points out, we're entering now, going to be entering into, you know, the festival period. Are governments taking this seriously?
Good evening, Sarah. The most important point that we are focusing on, I think, is the variant tracking as well as vaccination. I think these are two important strategic areas that we will need to closely watch. So the Genomic Surveillance Committee is very actively looking at monitoring which are the new variants, what about the current Delta trends, and even in the current positivity rate, which is at 1%, we're keeping a close watch at districts, and we're looking at even very closely, even in the vaccinated group, what is the infection rates. And these are the kind of vigilante that we will need to keep regularly monitoring. And in addition, I think a very important emphasis is to look at clearly adhering to reducing social and entertainment activities at this time, when you're closely watching the week to week 7-day average of the positivity rate. And I think we have emphasized that in April to March, April, if you see the trend, we started in the last week of March, we started jumping the numbers from 3% to 7%, and by the midweek of March, we were jumping at 5% every week. The positivity rate was jumping. This is very, very crucial for every one of us to watch, and closely Karnataka is watching at districts with variants and vaccination. So the 2 V's that they are focusing on is to look at variants, increasing vaccination, and at the same time ensuring that the social and entertainment activities are kept to the minimal, while we focus on the weekly 7-day average of positivity rate. Now, the moment we see that this jump is happening at a weekly rate of 5% is the time I think we need to really get alert to understanding that there is a bigger catastrophe ahead of us.
You know, Dr. Rao, the Karnataka Chief Minister, Mr. Yedurappa, also attended that virtual meeting with Prime Minister Modi along with the other Chief Ministers of the 6 states. Of course, then his private meeting with the Prime Minister overshadowed all of this, the fight against COVID in the state of Karnataka. But as you say, we have to be very careful about social events, social gatherings, etc. Yet at the same time, there's the reality. And Karnataka is opening up schools and colleges this week. With the R factors, you're saying at 0.95, just 0.75 4 weeks ago, vaccinations way below target. Where does Karnataka stand on the issue of vaccinations as you go into this crucial week, where you will be opening up schools and colleges, and many of them may not yet have, may not be eligible for vaccines?
So there has been a high-powered committee that has been specifically set up that is going to monitor the third wave, which is specifically got the Pediatric Association involved. We've got importantly, the education department key members involved. Our education minister and the health minister are both very closely monitoring this, and I think it's a top priority to watch how the schools are going to be following. And I think a set of detailed guidelines have been given to school, prioritizing vaccination for teachers and understanding the fact that below 18 is anyway 0%. We do not have any targeted vaccines at this juncture other than Sputnik, which has just entered for below 12, but we are nearly at 0% below 18. So acknowledging this fact, advisory given strongly on how schools and colleges will need to perform in terms of the teachers and their interactions also has been prioritized into this. With this having said and done, naturally weekly monitoring of positivity rate around schools is also going to be closely done. And what I understand is that pediatric associations of the state have actually volunteered forward where they are going to closely tie up with these schools or watch these schools. And the health minister has given directions that these pediatric associations will be closely working with the schools and their association and teachers associations to monitor this very closely.
All right. Dr. Vikas Bhatia, Director of the All India Institute of Medical Sciences at Hyderabad. We know a few weeks ago Hyderabad was in the headlines for the mammoth number of vaccinations carried out in a day. But the third wave of COVID is likely to hit India at the end of August. Now, doctors are saying, and the chances are that it will not be as intense as the second wave. That's what Dr. Samiran Panda, the head of epidemiology and infectious diseases at the ICMR, had told NDTV. Your thoughts? Would you agree that the third wave is not likely to be as intense as the second wave, and if so, why?
Yeah, thank you, Shara. Everybody wants to know the answer of the third wave because this is being deliberated, it is coming in media, and there are concerns. If we look epidemiologically and with the programmatic, from programmatic point of view, a lot of things matter. One thing which matters a lot is the gatherings. Now, what we see is that people are getting like COVID fatigue. You know, the moment they get some opportunity to go out, they start forgetting about the COVID appropriate behavior. Now, that's really very sad. When there is tragedy and there is a lot of pain and difficult situation, everybody, you know, is looking towards government, but when it comes back to the people, and then they forget everything. I think we need to understand that, and we need to take all precautions as far as possible. The second thing which is very, very important is the vaccination. Good thing is that now we have the vaccination. I see even in my own hospital we started, even I took on 21st January, and in fact everybody in our institute is vaccinated as far as the medical staff and every doctors, nurses and even students are concerned. Now we see a lot of people coming forward. That's one change I can find from the previous, because maybe the second wave has removed to some extent the hesitancy which was there in the month of January or so. Now, if we keep on moving like this, we need to, I was just calculating then, 18 plus, we will 40 lakhs vaccination per day, then we need about 9 to 10 months to reach to the that target group. That means 18 plus, if we want to reach the 80%, what we say as a good herd immunity, which is pretty long. But if we are able to increase, like more vaccinations are likely to reach India, which we hear in the month of August and September, then possibly if we are able to reach to 60, 70 lakhs per day or 80 lakhs, we have potential, we can do that. And we can quickly reach to a good level of vaccination. We can further delay this third wave, or even if the third wave comes, the intensity will not be that severe what we observed in the second wave.
So if we have increased our vaccinations, we can postpone either the third wave, or we can reduce the intensity of the third wave. I have Dr. Rajiv Jayadevan, Vice Chairman of Research of the Research Cell at the IMA in Kerala, member of the National IMA Task Force on the Coronavirus. Rajiv Jayadevan, what is Kerala's example showing up? What are we seeing there? Because we see the highest number of vaccinations coming out of the state of Kerala, yet it's the state that is contributing the largest to the number of fresh coronavirus cases in India.
Yes, Kerala at this point has a TPR in the range of 10. And if you track the TPR curve of Kerala right from the beginning of the pandemic, it's never been the same as that of the rest of the nation on the average. Kerala peaked very, very slowly in the beginning of last year, and it touched its apex in October, came down a little bit, plateaued at 5, and then went back up in January. There was a third peak. And now with the Delta variant, a large peak is just getting over, and TPR has dropped from 29 down to 10 at this point. Kerala's testing is quite efficient in the sense that most of the tests are being done on symptomatic patients and their controls, which are either clinic-based or hospital-based. There are very few random testing, which means that the test positivity rate will remain high. The downside of the excellent control that was done last year was paradoxically that more people in Kerala are still not exposed to the infection. So you know that immunity comes either naturally or by vaccination. Now, even though India has vaccinated a lot of people, more than many countries in the world, but the percentage is not very high.
Sure.
So likewise in Kerala, the total number of people that were infected was not really much in the last year, maybe 10% or a little bit more than that. So what we are planning here is to continue the pandemic safe behavior, open up the economy so people can make a living and the economy must move on, but stop all possible social gatherings, particularly indoor gatherings, and a lot of emphasis has been placed on educating the public about the dangers specifically of indoor gatherings. Now, outdoor, the virus does not pose such a threat. So prolonged continuing vaccination with all the data coming in. We know that today the data was released from the case control study about AstraZeneca vaccine or Covishield. Excellent protection against severe disease. That's the point I want to make here. People confuse vaccination protection. They can't differentiate between what is called breakthrough infection and severe infection. The vaccines protect against severe infection. That's really what we want to have. And if we have good vaccination coverage, even if a third wave comes, the casualties will be far, far lower than before. And that's what we hope for.
All right. But Doctor, interestingly, you say, so Kerala, given the fact that they have fewer people infected in the first wave in the months leading up to right now, means there are more vulnerable people right now. So you have to carry on with the COVID protocols, crack down on gathering, etc. Yet Kerala is going ahead with the Sabrimala, allowing devotees to attend Sabrimala.
That's my understanding that I don't know the protocol that they'll have in place for that, but any place where a lot of people will gather, regardless of the purpose, will spread the virus. There's no doubt about that. We saw what happened in Utrecht, Netherlands, when a 2-day music concert set off a wave of 1,000 victims of COVID-19. So whether outdoor or indoor, we got to be very careful.
All right. So as a doctor, you would not approve. As a man of science, you would not approve. All right. Thank you. Let me go in for a short break. We still have some more time on the show, so we'll come back with more questions after that. Thank you. Welcome back to our COVID show. We also have Dr. Zulfi Nuhu joining us, State President-elect of the IMA of Kerala. Dr. Nuhu, you know, there's this popular WhatsApp forward doing the rounds in Kerala. I'm sure you've gotten it too. My family from Kerala have gotten it about how they're really questioning the lockdown strategy in Kerala, where you close shops from certain hours. I'm sure you've seen it. If 100 people show up for a shop that's open for 8 hours, how many will show up when the shop is open for 4 hours? Your response to people who are critical of this strategy of the government?
Yeah, definitely. I think the government is slowly changing the policy. I think definitely there was some issues. If you open for 2 hours, the crowd will be same. Even if you open for 2 hours or 6 hours, the crowd will be same, and definitely there is an increased chance. So I think the government is changing the policy now. They are planning to open more shops, and hopefully they will be able to restrict the crowd also. It's very, very important. Indian Medical Association has requested the government to open up to restrict the crowd, not the other way around. So I think the government is considering that. But most importantly, I think we are requesting the Indian Medical Association, the doctor fraternity, and the Kerala people are requesting the government of India to provide more vaccine, even though the vaccination vaccination rate is high compared to many other states. We have a very high susceptible population out there, and the crowd mobility is also very high, very high population density, and definitely the Delta variant. We need more vaccination, and the vaccination is happening at a relatively slow speed compared to the requirement by which we can prevent the further spread.
All right. So, the state president-elect of the IMA Kerala coming out openly. Thank you for your candor, sir, to coming out openly to say that there is a shortage of vaccines in Kerala. This is a state that the Medical Association in Kerala has been clearly saying the people of this state are more vulnerable than those in other states, given the fact that not many contracted COVID in the first few months and in the first phase. So, special attention, special focus needs to be paid to Kerala, and more vaccines need to be allotted to Kerala at this critical stage, especially as right now it has consistently over the past few weeks been at the top of those 6 states contributing the largest number of fresh coronavirus cases. Initially, it was Maharashtra. So, Dr. Joshi, closing words to you before you could, any message for our viewers who are still watching, who think that, the worst is over. Before you get to that, could you explain how it seems when I look at these top 6 states, most of them seem to be from Maharashtra and then southwards, other southern states of India?
So 3 things. Number 1 is that yes, there is COVID around, and you know that always COVID starts from Kerala and Maharashtra as far as India is concerned. Whether it is the first wave, whether it is the second wave, that pattern has been pretty consistent. So therefore, there is a definitely red alert for all us to around, including other parts which don't have these red marks, that be on the alert. COVID is still around, and there may be a long time for the third wave to come there, but that can be shortened by inappropriate behavior. Second is vaccinate, and be prepared. So I think we cannot be absolutely complacent. It's time for us to wake up, and there is absolutely zero tolerance for COVID appropriate protocols not being followed, behavior not being commensurate, and absolutely no congregation. So that's really the challenge which we have. And we are population dense, whether it is Kerala or Maharashtra, but other parts of India also will have it. We are also transparent in many ways, and we are also doing our testing and reporting it as is, where is. So, but of course, we have a lot to improve, and we need to keep improvising.
All right. Dr. Rajeev Jayadevan, last words to you, a quick 30 seconds. What message would you give to our viewers watching the show right now?
I'd like to share the beautiful study that came out of India, a large case control study that compared 2 groups, vaccinated and non-vaccinated people. And the difference between the two, among vaccinated people, there were 96 people who had severe disease in the unvaccinated group, and those who were vaccinated, there was just 1. So that these numbers give you a very powerful message that if you're vaccinated, you're very, very likely to be protected, even if you were to pick up a mild infection. So vaccines work against the Delta variant. This particular study was against the Delta variant. It'll be a landmark paper. It's already on my Twitter. And it's a very large case control study done by CSIR. Go.
Well, we're glad to hear that, and of course we'll amplify that message as much as we can. I certainly myself waiting to get my second dose, hopefully by the end of this month. Thank you all doctors for your time, taking time out, and thank you for your service. Bye-bye.